So, what does it really take to become a nurse? Today, we're going to go behind the scenes, right onto the floor of a clinical facility to see how students take all that theory and turn it into actual patient care. Forget the textbooks for a minute. This is about the hands-on, high-pressure reality that truly forges a professional. All right, let's dive in. Right from the second they walk through the door, the stakes are incredibly high. Their clinical instructor, William, he lays it out for them. This is not just a class. Every single interaction, every move they make is being evaluated. They're not just representing themselves, but their school and their future profession. The job interview starts right now. So our guide for this whole experience is William. He's a substitute clinical instructor. And get this, his day job is in the ICU. He's stepping in to lead these first-term students, and you can just feel that sharp, real-world edge he brings to their training. He is about to set the tone for the entire day. Okay, so William kicks things off with a deal. He tells the students, look, you've got the freedom to choose which certified nursing assistant, or CNA, you're going to shadow today. But, and this is a big but, no scrolling on your phone at all. He expects them to be engaged, to be asking questions. After all, it's their education. He's a facilitator, not a babysitter. All right, so the rules are set. Now William gets to the first big lesson of the day, and you might be surprised what it is. It's got nothing to do with needles or medicine. It's all about the patient and how you as a student show up in their space, which is, a very vulnerable place to be. So William just throws the question right out there to his students. What is bedside manner? It's a term we've all heard, but what does it actually mean when you're on the job? And spoiler alert, it's not just about being nice. For a nurse, bedside manner is a strict, repeatable protocol that's all about safety, respect, and communication. See, this isn't just about being polite. It's a full-on safety checklist. And William, he breaks it down for them step by step. You knock to respect their space. You wash your hands and put on gloves to prevent infection. Every single time, no exceptions. You provide privacy because, dignity is everything, right? You use their name because they're a person, not a task. And you always explain what you're about to do because that builds trust. And to really make this stick, William has them flip the script. He's like, imagine you're the patient. A total stranger just walks into your room and starts touching you. No explanation, nothing. How confusing would that be? Maybe even terrifying. That right there shows you that communication isn't just some nice-to-have skill. It is absolutely central to safe, ethical care. Okay, so we've covered the human side. Now, let's talk hard data. Before these students can do anything, they have to know their numbers cold. So William puts them on the spot, starts quizzing them. Because, hey, what's the point of collecting all this data if you don't even know what it means? And just look at the level of precision we're talking about here. These aren't just suggestions. They are hard and fast rules. You see a systolic blood pressure over 130, that's stage 1 hypertension. A heart rate drops below 60 or spikes above 100, that's a huge red flag. Oxygen drops below 90%, that's an emergency. You have to act now. These numbers are telling a story, and these students have to be fluent in that language. And William's expectation here? It's absolutely non-negotiable. For him, knowing these ranges can't be something you have to think about. It has to be automatic, just like knowing that 1 + 1 = 2. Because when someone's health is on the line, there's zero room for hesitation. And this might be the most critical rule of the entire day. It's one thing to collect the data, right? But that's not enough. If any number is abnormal, their job is simple. Circle it and go find the nurse immediately. Just jotting it down and moving on, that's a huge failure. That communication piece, that's the safety net. All right, briefing's over. Time to leave the conference room and hit the floor. This is where all that theory, all those quizzes, it all becomes real, with real people. So the first group of students, they grab the vitals machine and they're off. They're going room to room, carefully putting on the blood pressure cuff, checking the O2 sat, logging every number. And for every single patient, they have to run through that protocol we talked about. Knock, wash, introduce, explain, every single time. So while that's happening, another group is shadowing the CNAs, and they're learning the absolute fundamentals of patient care. We're talking assisting with meals, helping with showers, learning the right way to move a patient safely. It's not glamorous work, not at all, but it is the absolute bedrock of what nursing is all about. And of course, for every single thing they do, they have to document it. The students are learning how to chart everything on a tablet. How much did the patient eat? Did they get turned every 2 hours to prevent bed sores? Every single detail has to be recorded. It's this super meticulous process, but it's crucial because it creates the legal and medical record of everything that happened. So, after a really long morning out on the floor, it's time to regroup for a debrief. This is where the magic happens, really. They share what they saw, they ask questions, and they start turning all those chaotic, real-world moments into lessons that will actually stick. One of the first things they talk about is just figuring out who's who. Like, what's the actual difference between a CNA and an RNA, a restorative nurse assistant? So your CNA, they're focused on those essential activities of daily living, the basics. But the RNA, that's a more specialized gig. You start as a CNA, and then you can train to become an RNA, helping patients with rehab, with getting their independence back. Then they get a great demonstration from a senior student who does a handoff report using this really important framework called SBAR. It's basically a simple, structured way to make sure no vital information gets dropped. You start with the S, the situation, then the B for background, A for your assessment, and R for your recommendation. It's designed to be clear, concise, and safe. And of course, William circles back to one of the biggest themes of the day. This next line, it's a mantra in the healthcare world. If you don't document, it didn't happen. Documentation isn't just busy work. It is the legal proof that you did your job. Think about it. In a courtroom, the chart is the only evidence. If there's an empty space, then legally, whatever you were supposed to do, it never happened. So what's the final lesson of the day? Simple. Always be prepared. William has this great analogy. He says, you're like a plumber. A plumber would never show up to a job without their tools, right? Well, a nurse is no different. You've got to have your stethoscope, your scissors, a pen light, a watch with a second hand, pens, and your blood pressure cuff. Being prepared isn't just a good idea, it's what makes you a professional. So when you pull back and look at the whole day, you realize something. Nursing is so much more than just knowing stuff from a textbook. It's about following protocols, it's about communication, it's about being incredibly meticulous, and it's about carrying this immense weight of responsibility for another human being. So the real question this training asks isn't just, what do you know? It's, are you ready to carry that weight?